There are also now a new type of EpiPen that's a dual EpiPen. So it's going to be not the gray one like that. It'll be a multicolored. You can pop that into the leg, flip it over, and about 5 to 10 minutes later, you can use the other side of it. It's got another dose of epinephrine in it. So that way, if it's taking a little bit longer to get EMS there, you've given them that other dose. It's pure adrenaline. Has anybody seen Pulp Fiction before? They jab that needle into the lady's heart and she jumps up. That's kind of what you're doing here. Not as dramatic, but it's going to be, their heart's going to start beating very fast. They may start sweating. You're just dropping straight adrenaline into their system. Another thing you could do with an allergic reaction, if it's not as severe as needing the EpiPen, is if you have Benadryl with you. Benadryl is an antihistamine. Histamine is what's building up in the system and closing everything off. So if you gave Benadryl, that may help reduce the allergic reaction as well. But the quicker you get the allergic reaction taken care of, the better off you're going to be, because once the throat completely closes off and there's no air going through, it's virtually impossible to get the airway back open to get oxygen into the lungs. So it's a pretty significant disease. Then you have diabetes. With diabetes, you could have somebody that's got very elevated blood sugar or very low blood sugar. You're going to be able to tell what they've got going on. If they have diabetes, are you going to know if it's high or if it's low? You're not going to be carrying a little glucometer with you for the most part. People who have diabetes, a lot of times if it's really high or it's really low, they may act about the same way. You may not be able to tell. You just know that they have a sugar problem and you don't know which way they're swinging. If you give them sugar and it's high, it's not going to hurt them. You give them sugar and they're low, it's going to get their blood sugar up to a point where they will be able to control their sugar after that. So regardless of if it's high or if it's low, you're going to give them like an orange juice, a piece of candy, something to get their blood sugar up to where they start being able to think a little more clearly. They're able to control their own blood sugar. They may be able to get something to eat at that point and then get some treatment. If they can swallow, again, you can give them something, but if they're unconscious on the floor or they're not able to swallow and they're just drooling, you can't put anything in their mouth because it becomes a choking hazard. So same thing, you want to catch a blood sugar quick if at all possible and get something into their system to help them out. They can get very violent as well, so you've got to be careful when you're dealing with somebody who's having a diabetic emergency. They'll act like drunks, they'll not know who you are and start fighting with you. It can be a scary situation sometimes, so it goes back to protecting yourself and just making sure that you are safe while you're taking care of this person. If they go unconscious, then they're not going to hurt you and somebody else can come in and get some sugar into them, either by a needle stick or putting an IV into them. You just want to kind of monitor what's going on with that. Anybody know what to do with burns? What would you do if somebody burned their hand on like a cup of coffee? Anything?
Rub some cool water over
Yep.
it.
Maybe not ice, because that may cause it to go the opposite way and then it break the skin. If you used a towel, possibly, but water is about the best thing to do. If you just copious amounts of cool water on the wound, and then you're going to bandage that up.
Oh, you bandage it?
Yeah. When you bandage it though, burns will burn from the inside out. And so everything's going to swell. So when you bandage it, do it very loosely so it allows for that swelling. But you want to put water on it for as long as you can to stop the burning. A lot of times if you cover up a burn and then you take that wrapping off, it could go from a 2nd degree to a 3rd degree while it was underneath that wrapping. That's sometimes just what will happen. So the better you cool it, the better off you are. If you don't know what's causing the burn, like if they've got a powdery substance on their arm and it's burning them a little bit, find out what it is before you would pour water on it. There are substances that react to water in a negative way and you pour water on it and then it's going to burn them even more. You can take something and brush it. Don't touch it with your bare hand, but like you can take a piece of paper and brush off whatever is on them. Find out what it is. You could call poison control, or 911 would get you to poison control. and then you can find out whether to pour water onto that or not. When you put a bandage on for a burn, you don't want to wet the bandage down. They would prefer that you keep it a dry, sterile dressing. And I think the reason for that is you're losing a lot of fluid from that burn, and water attracts to water. So if you soak down a bandage, more water is going to come out of the wound and make it worse. So most burn centers are asking you to just put it in a dry bandage. Don't put butter on it. Some people will do things like that, and that just seems like you're cooking meat or something when you're putting butter on it.
I always heard Vaseline traps the moisture.
It could, but it could also trap the heat, depending on how deep it is. If you're talking like a first degree or a sunburn, Vaseline might work, or like an aloe lotion. More when the skin is bubbling or when the skin is broke, is you don't want to put anything on there. Other thing is, if you took a rock, you throw it into a pond, you get that ripple effect. Same thing with a burn. So if I've got a 3rd degree burn on my arm right here, more than likely I'm going to have a 2nd degree and a 1st degree on the way out. It's going to be more intense in the middle of the burn and then work its way out. So you're going to have different pieces of that burn that you're going to be dealing with and wrapping up when you're doing your wrapping. Heat-related emergencies, talked about that a little bit with the fevers, with the children. With adults, they're now saying that you can just basically dump a bucket of water on somebody's head who's having a heat stroke. Don't make it ice water. That's going to be a little bit too much. But just a normal, like a room temperature type of water, you can dump that and you can cool them very quickly. They were concerned about seizures. Still an issue with kids if you cool them down too quick, but with the adults it's not as big of a deal. But you do want to get clothes off of them, get fluid into them if they're able to drink, and just cool them down pretty much as quickly as you can. With a cold-related emergency, you know what frostbite is? Just like the skin's dying, blackening. Do we want to rub skin together to warm it up?
No, just
Okay.
press
Yep.
skin to skin.
Mm-hmm. Skin to skin. Armpits. Use your friend's armpits. They're going to be nice and moist. Stick your hands in there. It's going to warm them up. If you stick your cold hands in your own armpits, your armpits are probably going to be cold because your fingers are frozen. So it's better to use somebody else's armpits. You can also use heat packs or cold packs depending on hot or cold emergency. Put them in the armpits, put them behind the knees, put them in the groin area. You've got arteries going through there that'll cool you off a lot quicker if you're doing that. You cool somebody or you warm somebody up from a cold related emergency, don't put them back in the cool environment. They will go back into their cold state very quickly. Their frostbite will get worse. Anybody who has ever had frostbite, it's going to be something that stays with them for the rest of their life. Tissue just doesn't come back after it dies. So if your finger dies from frostbite and you go back out in the cold, it's going to be painful and pretty nasty.
Is there also a danger of warming someone up too quickly, I think, isn't there?
There is. You could have cardiac arrhythmias. And they say, it's kind of a weird saying, I guess, but you're not dead until you're warm and dead. So if you have somebody you pulled out of an icy river, if they were warm, you would consider them dead, but in this situation, you would be doing CPR a lot longer than you normally would, because sometimes that heart goes into it kind of hibernates in a way. And they're actually now practicing, like when they're doing heart surgeries and heart bypasses and such, they will dump ice into the chest cavity. They found that if you put the body into that hypothermic state, you don't need as much blood, you're not going to bleed as much, and there's better results for that.